All right. All right, thank you guys. So, welcome back. We're here and we're talking about the my mom's transition from being a surgeon in the former Czechoslovakia to transitioning to being a psychiatrist in the United States. So, if you can continue on.
It was a very difficult decision for me to make because I didn't, I'm a woman, my time clock, so I didn't want to wait for years pursuing to be a surgeon. If I don't get it, what was I going to do? So as I said, God paved the way for me to do psychiatry. But what really made it easy for me is the fact that with my faith and also for my passion for medicine in general, whether psychiatric or surgery, my purpose is to serve a human being. So that's what made the decision easier for me.
All right, thank you. That is what medicine is. I completely agree. It's medicine. They tell me always in medical school, medicine is about people. It's a people business. One question I want to ask you, you only touched on it a little bit, but could you a little bit compare and contrast what it was like to be a resident in Czech Republic and the United States? What are some similarities and differences?
There are no similarities, but there are big differences, because when I remember when I was being doing internship and residency, there's no call schedule for the resident to be on call. Every time the attending, as I said, most of the call, if I remember very well, is the attending call. But as a resident, you want to do more surgery. So sometimes they put your name 1 or 2, but not necessary. Like, the attending is there all the time, So there were some calls, but not so intense like United States. And if you want to do more calls and more, to do so many surgery, because you have to have several surgical, to do before surgery, to do before you go to do your board exam. So that was easy. If I remember, in the United States, basically, the interns and the residents are the one manning the hospital. They are there all the time. They are attending most of the time. You're at home. They are there. They are on site. So it's very, very difficult, to do, residency and internship and such. It's time consuming, emotionally, physically, and everything, so it's very, very, very difficult, you learn a lot, but it's really, really, really time consuming, and it sucks a lot of energy out of you too. So I always tell, when I'm interviewing people to come on residence, I tell them that please try to do your USMLE 1, 2, 3 before you come. Because being an intern or being a resident is really time consuming.
How have you viewed people differently since you become a psychiatrist?
I haven't viewed anybody different. I view human beings as human. Even when I was surgery, everybody is the same. Especially, sometimes when people bring race and everything, I say, I was a surgeon, let me tell you, and I will show them when you are going to cut people. I said, the only few place is exposed. And as soon as you cut the skin, you will know whether the person is yellow, green, blue, and everything. So from that point, from being a surgeon and being a psychiatrist, human beings, we are the same.
So next question, you were mentioning earlier about medical interviews, because I know one of your previous jobs, you interview medical students.
Just be yourself, be precise why you want to be internist, or you want to be a psychiatrist, or don't sugarcoat anything. Be genuine. You should like medicine, because you are going to deal with human beings. Dealing with human beings are not very easy. Some patients will like you, some patients will hate you for no reason. So just dealing with human beings, you know that even your family, it's very difficult to deal with family members. So how that you have to deal with somebody who is not your family member. So I always tell people that that's what medicine is all about. You know, you should like it at least. Don't go to medicine that, oh, I want to be a medicine because it's prestigious. People will respect me. Just be yourself and love it. Because if you don't love medicine, and if you go to do medicine with these reasons, you will fail. You won't like it. You should have passion for it. That's all. If you want to do medicine because of the money, which is not true these days, or you want to be prestigious for people to call you, oh, doctor, and they bow down to you, you won't like it because you are going to deal with human beings, and dealing with human beings is not very easy.
So let's talk about what are some of the challenges of being a doctor in the United States? Because I have lots of foreigners who ask me, oh, the big money life in the United States and all that. So what could you tell the potential foreign doctors about being a doctor in the U.S.?
I can say that your life is so assured, you know, because they will, unless you do something that, you know, you'll be laid off total because of something, misfortune, is somewhere that anywhere you will get job, you will work.
And what would be some of the challenges? That's the good. Like, what are some of the challenges of being a doctor in the U.S.?
As I said, the challenges to be a doctor in the U.S. is challenges everywhere. To be a doctor, you are dealing with, you know, the challenges are you are dealing with patients. Okay, so you have patients who will like you or who won't like you. One of the challenges United States is the fact that is, I call it litigation country. Everybody wants to sue, you know, like, so you got to be very careful what you do. What we normally tell documentation. Anywhere that you go, you don't write so many notes like, you know, you document what you have done, everything is good, you do, but in United States you have to document in detail. Because it's litigation country, you don't know what will happen. You sit down and you have done everything that you do, and somebody come back and say, oh, I have a lawyer, you did this thing, I'm coming to see you. So this is the most challenging thing in United States. Documentation.
And documentation. Okay. So, all right. So I think that covers it. So do you have any last questions or comments you'd like to say about medicine?
Yeah, one comment, you know, like you asked about one of the challenges. I remember, you know, you asked me before just to laugh about it. Sometimes, you know, in medicine, sometimes you have to make it fun too, because it's very challenging to make it fun. And sometimes we laugh at work, we make funs, then we know that is challenging. And I remember one time I was going on rounds, you know, with one medical student. You know, medical students, they see you as an attending, they are so shaky, they respect you. I'm very easygoing, but, you know, but we're medical student too. We do that, you know. And then there was one patient who was Caucasian. As soon as he saw me and he said it under his breath, and the medical student was looking at my face. He was standing there shaking. He didn't know what to do, you know. And I just, you know, he looked at my face and I just looked at my car. I said, oh, I didn't know that I was like that. What you are saying, you are telling me. And, you know, it was, the medical student just breathed because he didn't know what I was going to say to this patient, you know. So I just made it up to him that I didn't even know what he was saying. So the next day, doing rounds with my colleagues, I told them about it. Everybody was cracking. You know, they were all laughing about what I did. I didn't scold the patient, but I said, I didn't know that what you are telling me. You are telling me, you know. So, it happens anywhere.